How does episcleritis affect raw eyes? Episcleritis is an inflammatory condition that impacts the episclera, which is the thin layer of tissue between the conjunctiva and the sclera, the white part of the eye. For individuals with rheumatoid arthritis, or RA, episcleritis is one of the more common complications associated with systemic inflammation. This condition typically leads to localized redness, mild discomfort, or a burning sensation, tearing, and sometimes sensitivity to light. Fortunately, it usually does not directly affect vision. In the context of rheumatoid arthritis, episcleritis manifests as inflammation that results in redness and irritation of the eye. Research indicates that about 5% of patients with RA may experience episcleritis, making it a relatively frequent extraarticular manifestation of this disease. Unlike scleritis, which involves deeper and more severe inflammation of the sclera, episcleritis is generally milder and less likely to cause serious complications or vision loss. However, it can recur and may signal active systemic inflammation in rheumatoid arthritis patients. Episcleritis often occurs in one eye but can affect both, particularly if there is significant autoimmune activity. The presence of episcleritis in someone with rheumatoid arthritis may indicate the need for careful monitoring and management of the overall disease activity. This is because ocular inflammation can reflected or coincide with flares of RA. From a clinical perspective, diagnosing episcleritis in rheumatoid arthritis patients typically involves assessing symptoms and conducting an eye examination. Sometimes, additional tests are performed to differentiate it from scleritis. Treatment usually includes topical anti-inflammatory agents, such as corticosteroid, drops, or non-steroidal anti-inflammatory drugs. If the episcleritis is linked to active rheumatoid arthritis, systemic immunomodulatory therapy, managed by a rheumatologist, may be necessary to control the underlying inflammation. While episcleritis itself rarely threatens vision, it is significant for those with rheumatoid arthritis because it can indicate systemic inflammation and may precede or accompany more serious ocular complications, such as scleritis or peripheral ulcerative keratitis, which can impair vision. Therefore, recognizing and treating episcleritis promptly in rheumatoid arthritis patients is crucial for overall disease management and preventing more severe damage.